Okay, good morning. We're all going to talk about hair transplants today. And hair transplants are a passion of mine. When I was a resident at Tulane, we started learning about hair transplants. And we learned with a doctor named Dr. John Yarborough. He was one of the pioneers in hair transplantations. And all of my colleagues would dread hair transplant day, because it's a very meticulous, very precise kind of procedure. And I thought they were crazy. So from the day I got to Tulane, I was able to do basically the majority of the work on hair transplants because everybody was like, you can have it. It's yours. And so I love it, and I'm really glad that we have it as part of our practice here. Now, today we talk about follicular unit transplantation. Now, that's the latest fad in hair transplantation. Now we have, this is relatively new, but we're going to talk about what that means. Okay, so now what we see here is this is looking at somebody's head who has a shaved head. And if you look, hairs actually don't grow in onesies. You know, before I started doing hair transplants, I thought they all grew in onesies, like one hair grew out of each follicle. But what you actually see is you have one follicle here, you have two hairs growing out of this follicle, you have 3 or 4 growing out of here, you have a cluster of 5 growing out of here. So they don't just grow as singles. So what we want to do is, to create a natural look, what you want to do is you want to create a look that occurs in nature. So we're not just going to transplant single hairs, we're going to transplant clusters of hairs as well. Okay, and so this is what we do. When we take them out of the scalp, we cluster them. And you can see here we have a 2 cluster, we have a 3 cluster, we have a 2 cluster. But in real life, what we're going to have is we're going to have 1 singles, we're going to have doubles, triples, and quadruples sometimes. And this really matters. So the question is, where do we get the hair follicles? And this is called the donor site, and where is it? Well, typically what we're going to do is we're going to take the hair from the back of the head. And this is showing classifications on how bad somebody's hair loss is. If you see here, there's just a little bit of peaking here. As we go down to more extensive hair loss, the peaking starts to occur here. And as it gets more severe, you can start to see it, guys losing their hair here and the top of their head. It's starting to recess here and along the temples as well. So it's receding backwards. We're getting temporal recession. We're getting this loss of the peaks here, and we're getting the little yarmulke look here. But if we go down to the worst case scenario for men, we'll see that most men will have this fringe of hair at the back. And have you ever seen that with guys where they have just this little strip of hair? Well, this is resistant to hair loss. So this is resistant to the DHT, and so that causes hair loss. So that's a great place to get hairs because they're never going to go away. Okay, so how do we harvest these donor hairs? Well, initially what we did was we took big plugs from the hair and we moved it to the front of the hair. And that gave that doll head pluggy look. And when people say, oh, I don't want that pluggy look, that's ancient history at this point. Because now what we did was we changed that to harvesting a strip of hair from the back here and that resistant to hair loss site. And so we just take a piece of hair from here and cut it out. And then we take this strip and we cut it into individual hairs. The downside with this was that it left a little scar here. Now for most guys who are wearing their hair a little bit longer, they say ½ an inch approximately, you're not even going to notice the scar. But hairstyles have changed, and if you look at most guys now, you'll notice that their hair is pretty short in the back. So this can leave a visible scar if you're wearing your hair too short. So what we've done is we've switched over to this technique where we're just taking little individual hairs from the back of the head. And so what is follicular unit extraction? It's taking the hairs, these hair bulbs, and instead of taking a strip, what we're doing is we're taking little punches and we're punching out individual hairs, and then we're taking that punch, making a hole and placing it in the front of the scalp. And so with this, you can see we go and we try to get the follicular unit. In this case, we're taking an individual hair. Here we're taking double hairs, and then what we do is we make the punch, we pull the hair out, and then we move it to the front of the scalp. Now the advantages to FUE instead of doing the strip are the scar should be invisible because we're just taking little individual hairs, so the scars heal up beautifully. Another reason we may want to use the FUE as opposed to the strip is if you've had multiple hair transplants, what happens is it gets tougher and tougher to close the scalp because there's less movement in the scalp if you take some of it out. I mean, that just makes sense. So if it's too tight, we can't do the strip grafting. If there's only a small number of grafts required, instead of taking a big strip, we can just take a couple hairs here and there to fill in a scar from a previous transplant. So some guys are concerned about the scar that they have in the back of their head that's a linear scar, and so what we can do is we can scatter those individual hair follicles into that. It's a faster healing time, and they say that there may be a little bit less pain. So now the disadvantage is it takes a little bit more time to do this procedure because with a strip it's pretty quick. We can take out 3,000 grafts in, Kara, what would you say, about 30 minutes? And then the techs start to cut them. So it's a lot quicker, number one. Number two, there's a little bit higher survival rate using the strip method as opposed to the individual grafting. And why is this? Well, you can see here, you have to get the bulge area, which is this area right here around where the erector pilae muscle and sebaceous gland are. And then we've got the bulb here. And in order for a hair to survive, it needs those two areas of the hair follicle. But you can see if you're slipping this punch down through the hair, it's easy to miss and transect the hair. Now, if you transect that hair follicle, it's not going to survive. So the survival rate with this procedure is lower than with doing the strip grafting. With strip grafting, they say it's about 90% survival. With this technique, they say in good hands, 70%. Now, there are surgeons out there that are going to say it's going to be higher, but that's still debatable whether it's higher. So we're just trying to perfect making sure we get the whole hair follicle. And so the other thing is, the other thing that affects the survival rate of the hair follicles, if you look here, these are what we call chubby grafts. And the reason we're calling it a chubby graft is you can see it's got a little bit of fat all the way around it. And that means that we're preserving the bulge area and we're preserving the bulb area. And so this is sort of like having its own natural environment around it. When you're doing the individual follicular unit extraction, oftentimes you'll see these are more naked. And so that decreases the survival rate a little bit as well. So now you can see the difference here is this is a strip graft, and this gentleman has his hair really short. He looks like he's a military guy, so he's got his hair short, so you can see it. Now what we could do is we could take some of these individual hairs and we could put them here. Now with the follicular unit extraction, what you see is you see this, and so when he has his hair when his hair grows out, this shouldn't be that noticeable. Now, the more aggressive we get with this procedure, the more hair follicles we take, the more scarring that's going to be left behind, and actually the advantage is really going to start to go away a little bit. So we use the SAFE system here in our office. We're also looking at the NeoGraft device, but we've had really good success with the SAFE system. It was developed by a hair transplant surgeon in Denver, and with this device what we're doing is it's a mechanical device that vibrates so it doesn't destroy the hair follicles, and so it's great for minimizing the scarring, reducing the pain. Almost all patients are candidate for the hair transplant procedure because it doesn't matter if you've had previous procedures or not. There's minimal follicular transection because instead of spinning and cutting the hair follicles, it vibrates around it. There's decreased time to perform the procedure. So here's what the device looks like, and it's got a little punch on that top of it, and it just vibrates around the hair follicle, getting it to come out. So we've got an increased harvest rate, and so it's being done much faster. Okay, so now when we talk about the art of hair restoration, this is one of the areas where art meets science, because if you know, the science is just pull out the hair and then plug it in. But the reality is we really have to make sure it's a natural hairline for our patients. And one of the things that we do is we try to create a hairline that's going to look natural for each individual patient. And what you'll notice is that, in the early days, what surgeons would do is they would just create just a straight line here. And a straight line really isn't the way our hairs naturally grow. Now, if we look at different ethnic groups, you'll see some variation. Oftentimes, African Americans are going to have, and Hispanic people will have a more straight hairline. And you'll see it even in our staff. Typically, Hispanic men will have a lower hairline, and it'll be a much straighter hairline. Whereas if you look at people of European descent, what you'll see is there's this temporal recession here. And I actually have temporal recession, and a lot of guys don't like that, but if you're of European descent, oftentimes that's part of a natural look. The other thing is, this is a guy who had the straight transplant, and it's pretty obvious that he had a hair transplant because, he doesn't have, it's a straight line, and he doesn't have any scattered little hairs here called sentinel hairs, which make it look much more natural. And you can see here George Clooney has the peaking hair, European descent. And also, the other thing that I think is really important is that we try to create this forward peaking here. Because with aging, what happens is this hairline sort of regresses backwards here and does not look natural. Okay, and I think this is a pretty good one. This is pretty tight, but it still looks relatively natural. I could buy that as being natural. And here you see the jagging. There's lots of peaks there. So the second thing that makes a hair look natural is the growth pattern. And hairs don't grow straight up like a chia pet. What they do is they actually grow at angles. And you can see these angles are really low. They're very close to the scalp. They're not growing up like this. They're really, really close. But if you look at your hair, you'll see people have swirls as well. So we want to follow the pattern of a swirl. I think it's called a Romuline, isn't it? Romuline. But if you look at my hair, you can see I have a pretty prominent one. It kind of grows like this. So we want to follow those natural angles in the scalp. And so, the question is, why contour? Well, there are lots of reasons. I'm board-certified dermatologist, which means that's important because this technique was actually developed by a dermatologist, number one. Number two, we have the greatest techs and team out there. Our techs have worked on celebrities. They're really great. We have Kara, who's been making the holes for 6 years now, and she's an artist with that. So we have great pricing, and this is the only choice I think people should use. So, any questions? Yes?
Do we do mostly the extractions, or do we do still?
We do more strip. The thing with this is it's a real fad to go to the FUEs. And there are still, I'm a member of the American Society of Hair Restoration, and they talk about how this fad is probably going to burn out just because the survival rate is lower, so you're going to destroy more hair follicles. If you do the strip, you're going to have a higher yield. The other thing is, as you do more and more of these, it's leaving more and more scar tissue back there, which is going to become visible, even though, if you're doing low numbers, it's not going to be visible. But the more you do, the more visible it's going to become because you're creating more scar tissue back there.
When you're pulling the hairs out, and you're actually pulling out the bulb there, does the hair go back in after you?
No, but the scar heals up beautifully because they're tiny little punches. They're 1 millimeter punches. And that's one of the problems is you have to make the punch so small in order to get the hair that they're not chubby grafts, they're naked grafts. And so that lowers the survival rate as well. So, yes?
Don't you kind of get like a free mini too with the strip because it pulls you a little taunt?
Unfortunately, no, because it's all in the back. It would actually work against us, honestly, because the thing is, it doesn't do it, though. No, because the thing is, the scalp is pretty adherent, so it doesn't move, it just stays right there. But it's a great idea. Yes. Anybody else?
Oh, sorry.
Okay, so we're going to do a quiz now. Okay.